Welcome to Angel Health Academy. Topic for the day is 5-year plans in India part 1. 5-year plans in India part 1. First let us see what is the reason for beginning the 5-year plans in India. So when India became an independent country during 1947, the country's leaders had the many challenges to make the country's economy very strong and stable. To make the country's national economy very strong and stable. Because as the British had left the country, they made Indian economy handicapped. That led into inflation. So the citizen had less money and they couldn't able to buy the things because the price of the commodity or price of the materials were increased. Such a situation led into scarcity in food, scarcity in other basic needs. Such a condition is called as inflation. So this is the reason why government of India started 5-year plans. So when India became an independent country after 1947, the country's leaders had many challenges to make the country's economy stable and strong. Because British had left the Indian economy as handicapped. That led into inflation in the country. That was the beginning of thinking about the 5-year plan in the nation. So thus government of India set up a planning commission on 15th March 1950 with the former Prime Minister Pandit Jawaharlal Nehru as the chairman for the planning commission. So on 15th March 1950, government of India started planning commission with our former Prime Minister Jawaharlal Nehru as the chairman of planning commission. Thus planning commission was assigned to do the task, various activities for formulating the plans for the most effective and balanced utilization of the available resources, money, material in the country, and determining many priorities based on the needs and problems of the people or citizen in the country. Thus, planning commission was assigned to task of formulating various plans for the most effective and balanced utilization of the available resources in the country, and determining various priorities and dealing with the priorities or solving the health needs of the citizen. Let us see what are the objectives of planning commission. There are 5 objectives in planning commission. There are most important 5 objectives of planning commission. That is, first one is to make an assessment. So to make the assessment of the available resources of the country or in the country, such as human resources, capital, that is budget, and the materials or goods what is available in the country. So to make the assessment of the available resources of the country. Second objective was to make socio-economic developmental plans in the country. To make socio-economic developmental plans for the development of the country, socio-economic development of the nation. Then third objective was to formulate 5-year plans. That is one of the most important objective of planning commission, or planning commission is established to formulate the 5-year plans in India. Then followed by to review the progress of the 5-year plans from time to time. That was the fourth objective, to review the progress which is made in the 5-year plans from time to time. And last one is to make recommendations, various recommendations in relation to the progress of the 5-year plans. So to make various recommendations necessary for the development of the nation in relation to the progress which had been seen in the 5-year plans. So these are the 5 important objectives of planning commissions: to make an assessment of the resources in the country, to make socio-economic developmental plans, to formulate 5-year plans in India, and to review the progress of the 5-year plans from time to time and make various recommendations which is necessary to develop the country, thus make the economy stable in our nation. So since then, planning commission frames the centralized and integrated national economic programs. So from 1950 onwards, planning commission started to frame the centralized and integrated national economic programs, various programs at an interval of every 5 years. So this program at an interval of every 5 years, thus the program was known as 5-year plans. So thus government of India made or adopted a formal model of planning in the country. Thus a formal model of planning was adopted in India. The first 5-year plan in India was launched or started in 1951, and there are 12 5-year plans in India. That means the 5-year plans in India ended with the 12th 5-year plan in 2017. So the first 5-year plan of India started or launched in 1951. And there are 12 5-year plans, total 5-year plans in India, and the 12th 5-year plan ended in 2017. Now let us see the history of 5-year plans. So the father of 5-year plan is known as Joseph Stalin. He is a Soviet political leader who was first introduced 5-year plans in the Soviet Union in the late 1920s. So in late 1920, Joseph Stalin, Soviet political leader, implemented the first 5-year plan in the Soviet Union. Then followed by the most communist states and several capitalist countries subsequently have followed that 5-year plans. So the father of 5-year plan is known as Joseph Stalin. Then, as we have already discussed, in 1950 the Planning Commission was set up in India to start or formulate the 5-year plans. Gulzarilal Nanda was the first deputy chairman of Planning Commission of India. That is, Gulzarilal Nanda was the first deputy chairman for Planning Commission in India. Then Planning Commission in India used to directly report to the Prime Minister, then Prime Minister of India. So Planning Commission had to directly report to the then Prime Minister of India related to the progress what they have reviewed, related to the various focus and priorities they had set for the different 5-year plans. Then on 8th December 1951, the first Prime Minister, our former Prime Minister, Pandit Jawaharlal Nehru, presented the first 5-year plan to the Parliament of India. So first 5-year plan was presented by Pandit Jawaharlal Nehru on 8th December 1951. That was the beginning of the first 5-year plan in India. So Government of India established the first 5-year plan in 1951. Then as we have already said, the last 5-year plan, that was the 12th 5-year plan period, was 2012 to 2017. That was the period of 12th 5-year plan. It is the last 5-year plan of India. So in India, 5-year plans were ended on 2017. On 1st January 2015, the decades-old 5-year plans and Planning Commission were replaced by the newly formed NITI Aayog, that is National Institution for Transforming India, by our Honorable Prime Minister Narendra Modi with his NDA government. So from 1st January 2015, the Honorable Prime Minister Narendra Modi with his NDA government replaced the then existing 5-year plans and Planning Commission by starting a new form of NITI Aayog, that is National Institution for Transforming India. This is the end of the 5-year plans and Planning Commission in India. Now let us discuss about the various 5-year plans in India. So 5-year plans of India are framed, executed, that is implemented, and monitored by the Planning Commission of India with various aims, such as first one is to rebuild the rural India, develop the rural India, then make a foundation for industrial progress, that is for development of the various industries. So to make foundation for industrial progress in the country. And last one is to secure the balanced development of all the parts, all the states in the country. So to secure the balanced development, not only the states, but also in the agricultural field, industrial progress, economic stability, like that balanced development of all parts of the country. So Government of India started a 5-year plans in 1951, that was framed, executed and monitored by the Planning Commission, which have been set in 1950 with certain aims. The aims of 5-year plans are to rebuild rural India, to make foundation for industrial progress in India, and to secure the balanced development of all parts of the country. Then, in addition to that, Planning Commission given considerable importance to health and health services or health programs in the 5-year plan. So, Planning Commission even given considerable importance to the health of the citizen, various health services and health sectors, and various national health programs in the 5-year plans. So, the overall goals of 5-year plans are growth, modernization, self-reliance and equity. The overall goals of 5-year plan was growth of the country and modernization of the country, self-reliance in the country and equity among the citizens. These are the goals of 5-year plans. Now let us see what are the objectives of 5-year plan. First objective was economic stability of the country, economic balance of the country. So that was the important reason why we have started a 5-year plans. So to make economic stability. Second one is social and community services for the citizen in the country, social and community services, to render social and community services or to provide social and community services for the citizen. And third one is strengthening the basic health services in the country through establishment of various health centers such as primary health centers, sub-centers, taluk health centers, district hospital, etc. So strengthening the basic health services for the citizen in the nation through establishment of various health centers. Then population control through family planning. Population control through family planning. So the fifth objective is development of various health manpower or health personnel in the country. That is health manpower resources. Development of various health personnel, staff for rendering health services in the nation. So this objective is in relation to health and health services in the country. Then last one is in relation to health. The objective was control or eradication of various major communicable diseases in India. To control and either to control or to eradicate the major communicable diseases in the country. Communicable diseases are nothing but the diseases which transmit from one person to other person. That is an infectious diseases. So these are the 6 objectives of 5-year plans in relation to health. First one is economic stability. Second one is social and community services. Provision for social and community services or rendering various social and community services for the citizen. Then strengthening the basic health services to the citizen through health centers such as primary health centers, sub-centers, district health hospitals, etc. Then population control of the country through implementing family planning methods and programs. Then development of health manpower resources, that is nothing but health staff or health personnel or health workers to render the health services to the citizen of the nation. And last one is control or eradication of various major communicable diseases in India. Then the period of 5-year plans. So let us see the period of 5-year plans. So before we go to the period of 5-year plans, we can have some techniques or tips to understand for the easy understanding of the periods of 5-year plans. So as we have already discussed, there are total 12 5-year plans in India. That is, first 5-year plan is started in 1951 and our 5-year plan 12th one is ended in 2017. So there are 12 5-year plans. First is started in 1951 and 5-year plans ended with 12th 5-year plan in 2017. There are 3 outlays in between these 12 5-year plans. 3 outlays means 3 breaking of the continuation of the years. So 3 outlays. The first outlay, that was a 3 years annual plans and followed by there are 2 years annual plans in between these 12 5-year plans. So that is an important point to remember. There are 3 outlays, that is the discontinuity of the continuation of the 5-year plans. That is, first one is with 3 years, that was called as 3 annual plans. Then followed by there are 2 years annual plans. So this is the very important thing to remember while studying understanding the periods of 5-year plans. Then there are one important things in the 5-year plans. Out of these 12 5-year plans, one 5-year plan is having only 4 years. That is the 5th 5-year plan. So 5th 5-year plan was only 4 years, not 5th years. The reason why it has become 4 years, not 5 years, we will discuss later when we discuss about the 5th 5-year plans. So these are the important tips to understand about learn the periods of 5-year plans. First one is there are total 12 5-year plans. Then first 5-year plan in India started in 1951 and the last 12th 5-year plan is ended in 2017. There are 3 outlays or discontinuation of the series of the 5-year plans. That was, there are 3 outlays. First outlay was 3 years annual plans. Then 2 years annual plans. Then 1 5-year plans out of these 12 5-year plans had only 4 years. That was the 5th 5-year plan. Now I have to write like first 5-year plan 5 years, 5, 5, 5. So first 3 5-year plans same 5 years only. Then there are first outlay, that is 3 annual plans. That plan was called as holiday plan. So holiday for the 5-year plans. So instead of 5-year plan we have 3 single annual plans. That first 3 single annual plan was known as holiday plan. Then followed by 4th 5-year plan is a continuation of 5-year only, that is 5. Then 4, as I already said, 5th 5-year plan in India, though we call it is a 5th 5-year plan, unfortunately we have only 4 years. So you have to write 5, 5, 5, then 3, first annual plans, 3 annual plans, then 5, 4. Again, after 2 5-year plans, so that is 4th and 5th, again a 2 years annual plans, that plan was called as rolling plan. So 2 years, 2 annual plans, that was known as rolling plan. Then again continuation of the 5-year plan, so that is 6th 5-year plan, that is 5 years, and 7th 5-year plan, that is 5 years. So again 5, 5. Then again after the 2 5-year programs, so that is after 7th 5-year plan, again an annual plan of 2 years, that is 2 annual plans. Then followed by continuation of 5 5-year plans, that is starting from 8th 5-year plan, 5, 5, 5, 5, 5. So what you have to remember means first 3, 5 you have to write, then 3, that is annual plans or outlay, then again 2, 5, in that 5th 5-year plan you can make that is like 4, then again after that 2, that is 2 annual plans, then you have to write 5, 5, then again the 2, then continuation of 5, 5, 5, 5, 5. So how to write 5, 5, 5, 3, 5, 5, that 5 if it is 5th you have to make a 4, then 2, 5, 5, 2, 5, 5, 5, 5, 5. 5, 5. So ending with the 12th 5-year plan in 2017. That is 2012 to 2017 was the period of 12th 5-year plans. Okay, let us see what are the periods of 5-year plan. So that means Government of India started a first 5-year plan with 5 years, that is from 1951 to 56. So 1951 plus 5 years, that is 56. Then second 5-year plan, as we said, it is a continuous 5 years, 3 5s. So second 5-year plan, that is 56. See, all the 5-year plan is starting from the previous 5-year plans last year, that is 56. So 1956 plus 5, it is 61. So second 5-year plan period is 1956 to 61. Again third is starting from 61 only, that is important point. That is continuation of the same year only, next 5-year plan could start. So 1961 plus 5 years, that is 66. So third 5-year plan period is 1961 to 66. So you have to remember first 3 5, that is starting from 1951 to 56, 51 plus 5, that is 5 years, that is first 5-year plan, then followed by 56 to 5, 61, that is second 5-year plan, that also 5 years. Then third is 1961 to plus 5, that is 1966, that is 5 years, that is third 5-year plan. After the continuation of third 5-year plans, you can remember that 1, 2, 3, there are 3 years, 3 annual plans. Okay, so that is 1966 plus 3, that is 1969. So 66 plus 3, that is 1969, 3 annual plans, that is 3 annual plans, first, second and third. This plans was called as holiday plans, that is holiday for the 5-year plans. Instead of that we have 3 separate or different annual plans. Then after that again we are continuing with the same 5-year plan, that means it has started with the 1969 to 9 plus 5 years, that is 74. That is fourth 5-year plan. Then continuation only 1974 to, we know that it is instead of 5 years that had only 4 years. So 1974 plus 4, that is 1978, that is 5th 5-year plan. So 1974 plus 4, that is 1978, that is 5th 5-year plan. This is the important point you have to remember. There is only one 5-year plan which has only 4 years, that is 5th 5-year plan. After the 4th and 5th 5-year plan, after the 2 5-year plans, see 1, 2, we have 2 annual plans that you have to remember. That is from 1978 plus 2, that is 80, that is 2 annual plans. That annual plans are also known as rolling plans. We are rolling the plans, 2 annual plans. So up to 80. Then followed by again continuation of 5-year plans, that is 1980 plus 5, that is 1985, 6th 5-year plan. Then 1985 plus 5 years, that is 90, that is 7th 5-year plans. So again after 2 5-year plan followed by immediately we have 2 years of annual plan, that is from 1990 plus 2, that is 1992. 2 years annual plans. Then followed by continuation you have to add 5. 92 plus 5, that is 97, that is 8th 5-year plan. Then 97 plus 5, that is 2002, that is 9th 5-year plan. Then again 5. 2002 plus 5, that is 2007, that is 5 years, 10th 5-year plan. Then 2007 plus 5, that is 2008, 12, that is 11th 5-year plan. The last 5-year plan, that is 2012 plus 5, that is 2017, that is 12th 5-year plan. That was our last 5-year plan. So after a third annual plan, that is after the 7th 5-year plan, we have 2 years of annual plans. Then continuation of the 5 5-year plans. That is 5, 5, 5, 5, 5. So 5, 5, 5, 3 plus 3, 5 plus 4, 2, 5, 5, then again 2, then 5, 5, 5, 5, 5. If you remember, if you are able to understand this, you can add the 5 and you have to remember the annual plans in between the 5-year plans. So this is the periods of 5-year plan. Now let us discuss each 5-year plan. That is first 5-year plan. As now we know that period of first 5-year plan was 1951 plus 5, that is 1956. So the draft of the first 5-year plan was published in July 1951 and was approved by Government of India in December 1951. So the first draft for the first 5-year plan were given or was published in July 1951 and followed by it was approved by the government in December 1951. Then the first 5-year plan was launched for the duration. We are already know the 1951 plus 5, that is 1956, under the leadership of our first former Prime Minister Pandit Jawaharlal Nehru. So first 3 5-year plans. So the Prime Minister during the period was that is Pandit Jawaharlal Nehru. That also you can remember. So the first 5-year plan was launched for the duration of 1951 to 56 under the leadership of our former first Prime Minister of India, that was Pandit Jawaharlal Nehru. So next is the objectives of first 5-year plan. The first objective was to improve the living standards of all the citizens or all the people in the country. That is to improve the living standards of the population in India. Then second objective was to utilize maximum utilization of the available India's natural resources. So making maximum utilization of or use of the India's natural resources. The last objective was to set the annual growth rate of the first 5-year plan in the GDP. GDP is nothing but gross domestic product. That is the maximum economy of India from the maximum production in all the sectors and all the developmental sectors. That is gross domestic product as 2.1% per year or every year. So these were the 3 important objectives of first 5-year plan. First one is to improve the living standards of living of the people in the country. Second one is maximum utilization of the India's natural resources for the development of the country. And last one is to set the target, that is annual growth target of the country within the GDP, gross domestic product, as 2.1% per year or every year. And at the end of the 5-year plan, it will be reviewed and it will be checked whether the target of the annual growth is achieved or not. That says the failure of the success of the 5-year plans. Then another important thing, each 5-year plan is, or most of the 5-year plan is following certain models of economic development. So in first 5-year plan, it was based on the Harrod-Domer model. This is Harrod and this is Domer. Those who are developed one model of development of economy, that is Harrod-Domer model. So you can remember that which is the model used in the first 5-year plan, that is Harrod-Domer model, with a few modifications from their model, which is mainly focused, this model is focused on the development of the economy of the country, development of the economy in terms of the level of saving. So making many savings and improving the capital of the country, thus development of the economy of the country. So the first 5-year plan was based on Harrod-Domer model. Now you can see that how Harrod-Domer model works. So Harrod-Domer model is a cycle, so that can be start from any side. So we can start from the increased investment. When we increase the investment in the country, automatically our capital stock will be increased. So with the increased investment, that will higher the capital stock of the country. When capital stock of the country increased, we have a higher economic growth. Then high economic growth will lead to increased saving in the different sectors. So increased saving, automatically increased saving will continue, or which helps to increased investment, that will be followed the Harrod-Domer model. So this is how Harrod-Domer functions. Though this model is adopted by first 5-year plan in India. Now, second important point we have to remember, each 5-year plan is having a particular or specific focus. That means that varies from 5-year plan to 5-year plan. So you can remember which main focus of the particular 5-year plan. All the priorities of the 5-year plan were based on the focus. So the main focus of first 5-year plan was on the agricultural development of the country. So the main focus of the first 5-year plan was agricultural development. So you have to remember, agricultural development is the main focus of first 5-year plan. So next is the priorities of first 5-year plan. So the priorities will be based on the focus. The main focus of first 5-year plan was agricultural development. So I have made a mnemonic in relation to first 5-year plan's priorities. So you have to make either a certain mnemonics or a certain tips to remember each 5-year plan, because we have 12 5-year plans, 12 specific focus and different priorities. So it is very difficult to remember and understand the clear-cut priorities of the particular 5-year plan. So it is easy to have a mnemonic, and through mnemonic you can easily remember or collect the information in relation to that particular 5-year plan. So I have made a simple mnemonic here, that is a common tips for agricultural development. You can think like that. In first 5-year plan, Government of India used a common tips to develop the agriculture of the country, to increase the economy. So a common tips for agricultural development. A common tips, in that you have to remember tips instead of TIPS. I have made one more P in the priority. So tips for agricultural development. Now let us expand this common tips. So that means there are 7 priorities are there in relation to agricultural development. First one is A. A stands for agriculture. Then second is common. Common stands for communication. So development of the communication in India. T stands for transportation. I stands for irrigation projects. Government of India given importance for 3 important irrigation projects. This irrigation is necessary for the agricultural purpose. Then power also, electricity also necessary for agricultural development. So P stands for power. The next P is price stability. Stability of the price. So economic stability was an important or the reason for starting 5-year plan in India. So P stands for price stability, and last S stands for social and community services to the citizen. So all the 5-year plans, they have social and basic services for the public or the citizen, for their health and welfare. That is social, and S stands for social and community services. So the mnemonic is a common tips for agricultural development. With that you can remember the priorities of the first 5-year plan. So let us discuss in detail about the priorities of first 5-year plan in India. So the priorities of the first 5-year plan include, first one is to focus the agricultural development, that is agriculture. Second priority is communication development. So we have a Ministry of Communication for the communication process. So communication development. Third priority is transportation. Transportation also very important for the development of the agriculture in India. So transportation. Then fourth priority was irrigation projects. Government of India given importance for 3 important irrigation projects in first 5-year plan. First one is Mettur Dam. You can see this is a Mettur Dam of Tamil Nadu. Second development of the dam, that was Hirakud Dam, that is in Odisha. That is development of Hirakud Dam for the irrigation purpose. And last, third important irrigation project in the first 5-year plan was Bakra Dam, that is in Bilaspur, Punjab. So in first 5-year plan, 3 irrigation projects were started or dam were constructed, like Mettur Dam in Tamil Nadu, Hirakud Dam, that is in Odisha, and Bakra Dam, that is in Bilaspur, Punjab. This is an important point to remember, that what are the irrigation projects Government of India established during first 5-year plan. Then followed by next priority related to power development, electricity development for the purpose of agricultural development. Then stabilize the economy or price in the country. So price stability. So to remove the inflation or to overcome the inflation, the stability must be given for the price. So price stability, that was the 6th priority in the first 5-year plan. Then last priority, that is social and community services. This priority will be common in all the 5-year plans, because Government of India given important for many social and community services throughout the 5-year plans. So social and community services in the first 5-year plan also I have made a small mnemonic. This is not so important mnemonic. If you want, you can use, or you can directly study the social and community services rendered in the, or comes under the priority of the first 5-year plan. Health care by health personnel. Personnel is nothing but health staff through health programs. So Government of India introduced many national health programs during first 5-year plan. So mnemonic is health care by health personnel through national health or various health programs. Health care, that is Government of India given importance for rendering health care for the rural populations. For that, first primary health center is established in 1952. You know that first 5-year plan is started in 1951. After that, 1952, Government of India established primary health center in India to render the health care services to the rural population. So that is health care. In health care, you have to remember establishment of the primary health center in 1952. Then health personnel. So Government of India given training and education for the health staff or health personnel to render the services through the primary health center and through other existing health institutions. So education and training for the health personnel or health workers in the country. And Government of India during the period of first 5-year plan has introduced various national health programs started in 1951 to 56. So as it is 56, you can remember there are 6 important national health programs were started during the period of first 5-year plans, that is between 1951 to 56. That is in 1952 National Family Planning Program. So Government of India introduced a National Family Planning Program in 1952. And Government of India is the first country to introduce the National Family Planning Program, and followed by 1953 National Malaria Eradication Program (NMEP), that is anti-malarial program in 1953. Then followed by 1954 National Water Supply and Sanitation Program in India were started. Then in 1955 there were 3 national health programs such as a National Filariasis Control Program, National Leprosy Eradication Program, and National Japanese Encephalitis Control Program. So these are the national health program were introduced during the period of first 5-year plan between 1951 to 56. So let us discuss in detail about the social and the community services during the period of first 5-year plan. So as we have already discussed, the first plan was health care for the rural population. So Government of India introduced primary health center in 1950 to render the health care services to the rural population. Second is Government of India given education and training for the health personnel. That is the community health workers and other health staffs to render the health services through the primary health center and through other existing health institutions. So health personnel education and training. Third is in relation to the national health programs. So that is family planning. India was the first country in the world to start the national program for family planning, that was started in 1952 to control the population. So India was the first country in the world to start the national family planning program, that was started in 1952. Then second program, malaria control program, that is malaria control, that is the another priority given in the social and community services, that is malaria control. In 1953 Government of India started a National Malaria Eradication Program (NMEP) in India to control malaria in the country. Then safe water and sanitation. The fifth priority is safe water and sanitation. For that Government of India in 1954 started a National Water Supply and Sanitation Program. National Water Supply and Sanitation Program in 1954. Then filaria control or filariasis control. So in 1955 Government of India started a National Filariasis Control Program in India. That is National Filariasis Control Program in 1955, along with the other 2 programs such as leprosy eradication. For that Government of India started a National Leprosy Eradication Program in 1955, same year 1955. Then one more program in 1955, that is for the control of the Japanese encephalitis in the country, that is National Japanese Encephalitis Control Program. That is National Japanese Encephalitis Control Program in India started in 1955. These are the important national health program that was started during the period of First 5-year plan 1951 to 56. When it comes to the review, the First 5-year plan was successful plan because primarily the first 2 years of the First 5-year plan we had a very good harvest, and we have achieved the growth rate. The government of India had achieved the growth rate, that is annual growth rate of GDP 3.6%, as it was more than its annual target. We had set only 2.1% per year. So the First 5-year plan in India was very successful because we have achieved the annual growth rate of GDP 3.6%. That was more than the annual growth target we had set during the objectives of First 5-year plan, that was 2.1%. So we have discussed in depth about the First 5-year plan. Now let us summarize the First 5-year plan in India. So summary of First 5-year plan in India. So after studying in detail about the particular 5-year plan, you can make a table like this. Then you can, at a glance, you will get the information regarding that or specific points regarding that particular 5-year plan. So that the table can include a period of 5-year plans, prime minister, model that was used in the 5-year plan, focus and priorities of that particular 5-year plan, annual growth target set for the 5-year plan, and growth achieved. So target set and target what was achieved. So this will be at a glance, we will get a complete picture of the 5-year plan. So this is about First 5-year plan, the period between 1951 to 56. Prime Minister, the chairman for the First 5-year plan was Pandit Jawaharlal Nehru. The model was followed, Harrod-Domer model, that was for the economic growth of the country. Then priorities of the First 5-year plan. It was mainly focused on agricultural development. Priority given agriculture, communication, transportation, irrigation, power, price stability, and various social and community services. So you can remember our mnemonic, a common tips for the agriculture development in the country. Then we had many social and community services such as health care for the rural population, that is PHC, started in 1952. Development of the health personnel or health staff, that is through education and training. Then various national health programs such as family planning program in 1952. Then malaria control program, safe water and sanitation program, filariasis control program, leprosy control program, and Japanese encephalitis control program. Our GDP annual growth target GDP was at 2.1% per year, but we have achieved at the end of the 5-year plan, First 5-year plan, annual growth GDP achieved was 3.6%. So First 5-year plan was very successful in India. So thanks for watching. Hope this video really benefits in your studies and different exam purpose. If you feel it is worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the second part of the video of 5-year plans in India. Thank you.